Hi everyone, I'm Steve Main here with Dr. Nario. Dr. Nario is with Biointegrative Health Center in Reno, Nevada. Check him out online. If you want to get a hold of me or reach out to me, you can get me at stevemain.com. So welcome, Doctor.
Hi, Steve. Always a pleasure to be here.
Okay, and I just want to say if you guys, like this stuff, these interviews that we're doing, please subscribe to the channel. So UVBI. We talked a little bit about this last week, but the excitement, the enthusiasm around the clinic, I've noticed, people are really buzzing about this treatment. As a matter of fact, I'm going to get it in a couple days and see what happens. So, UVBI, it's called ultraviolet blood irradiation. Is that correct?
Irradiation. Yep, that is correct.
Irradiation. Okay, so last time we called it blood ozone. So, um, can you just describe it again? I mean, we titled it, differently last time, but first, just kind of give us a brief overview of what I just tried to pronounce.
Yeah, it's a tongue twister, Steve. The thing here is the UVBI machine or ultraviolet blood irradiation. It's actually a little like shoebox, and then as your blood passes through this device, it actually gets irradiated or exposed to the UV lights. So these UV lights are actually the ones that powers up your blood. So going back to, we use the UVBI or UBI acronym for it, is a procedure that removes blood from the body and then exposes the blood to UV light through a cuvette. So a cuvette is a small cylinder quartz. It's almost like your fluorescent light, but very small. And then blood is returned to the body after the blood gets exposed to the UV lights in the cuvette. So later on, I'm going to explain to you what the cuvette is for. And again, in the last decade, there's been a resurgence of this technology. And now over 1,000 physicians using this in their practices, over 300 medical studies. I mean, even Harvard had labeled their studies with this, and over 1 million therapies have been administered worldwide. So this is not really new. We just have a newer device and a more technologically advanced device. And UBBI is helping patients that have tried almost anything. So this is almost given to our last resort patients who actually just, hey, I've tried everything, nothing works. Or maybe even for the simplest cases that we have, like athletes, for example, who just wants to recharge and regenerate. And it's an essential tool for many chronic disorders, easy, effective, low cost if you compare it to other facilities. And it's very cutting edge because we're using the newest UV and LED purifier in the market. And it has light spectrum LEDs, natural white, 4 UV light bulbs, in total 2 UVC, one UVB, and one UVA light in this small shoebox that delivers all these wonderful lights to the blood of the patient.
Okay, so I'm wrapping my brain around this, and yeah, I mean, I just hear I guess you could say the testimonies of people who have done this treatment in the clinic and from pain going, and it's like everyone's different. It's like
Mm-hmm.
uh, you were saying, before we got on tape that it made you sleepy, and I've heard that multiple times.
Mm-hmm.
Relaxed is a better word.
Right.
Um, but so you have these lights in this cuvette,
Mm-hmm.
and the lights go through the cuvette, or how does that work?
So, Steve, the cuvette is almost, I want you to imagine blood passing through it, the cylinder. And then it's almost like cooking the blood with UV lights. So this cylinder runs through, and then outside that cylinder are the laser lights. So it's almost like cooking your blood. And again, what's special about the cuvette and the lights? So the lights are actually, again, I mentioned a while ago, UVB and UVA. And these two lights, as you know, we hear this a lot with sun exposure, destroys our skin. But if actually used properly and regulated through this machine, It's immunomodulatory, meaning it targets and stimulates the cells to restore balance in the immune system. And then the one special UV light in this device is the UVC. UVC is the germicidal. This is the one that kills bacteria, viruses, fungus, yeast, and any pathogen causing the immune response or a bad reaction from your immune system. And studies had shown that UV light can only penetrate again. So this is the usual. So if you're not using the newest versions of these, so this cylinder, when UV light goes through it, there you're only touching the surface of your blood. It's almost like touching your putting your finger on top of a pond, and that's just it. You're not dipping the whole finger in there, and that's what the old machine does. That they only expose the blood on the surface. That's why you're not maximizing the therapy. But with this new advancement that we have here in our clinic, we're using a special cuvette that actually spirals. So, meaning it's shaking the blood up so that you can expose not only one surface, but the whole part of the blood that goes through it. So, it's like shaking it up as it goes to the UV light. So, every part of your blood is exposed.
Okay, so okay, I'm starting to get it. So these lights, all these different multiple types of lights that you mentioned,
Hmm.
impact the blood for the benefit of the person getting treated.
Hmm.
Okay,
Right.
and so and you mentioned what some of these different lights do, but the blood is being treated, which obviously is going to affect the body. So um, in multiple positive ways.
Right.
So, is there any prerequisites? Can somebody like I know that I get a lot of treatments at the facility there at Biointegrative, and I can go in and get it because my body's prepared for it. My body's been treated with many other things.
Right.
But if somebody just wants to walk in and say, "Hey, I want this treatment," what are the prerequisites? Is there any? I mean, I'm assuming that, and would everybody be different? Would it depend on the questions you ask them or the condition that someone's in? Would their prerequisites be different than someone else's? So, can you talk a little bit about that? What does it take to get this treatment? And just walk in and do it, or I'm sure it matters, the health of each person, but what about that?
Right. So, Steve, if in an ideal world, if I could give this to everybody, I would. This is just because of the things that I've seen, the studies that I've read, and things that I'm looking forward to with the advancement of this machine. But the thing is, there you are right. There are criteria or prerequisites before you can get the treatment. Number one, good vein access, for the reason that it's going to be hard for somebody to get blood out of them if, to begin with, you don't have a good outlet for your blood to come out. So that's why when I say good vein access, meaning we have our staff here, as you know, are really good at that, finding these good veins so that we can access that and put it in the machine. So, but again, it will be a challenge if you have like little tiny veins. But if you have good, chunky, bulky ones, hey, you're almost there. But here are the other ones that we criteria that we kind of look out for. So, cases that you have clotting disorders in your blood, again, genetic, may you be very inflamed that your blood can clot as we suck it out of your system. So definitely that's like one contraindication. If you have blood thinners, yeah, we can still tweak that. We can play around with it and still do the therapy on you, but there will be some adjustments that will be done. And also low platelets because you're gonna be more prone to bleeding. That's why we want to be cautious about this. If you're sensitive to light, I mean, just because the machine generates light, it's not an absolute contraindication. But again, if light triggers a seizure, for example, we don't like that. But very very small in population. And even when you take medications that are sensitive to light, for example, you're taking sulfa drugs for antibiotics, and they're very light sensitive. So if you take it today and we're going to clean that blood out, you're going to render that drug ineffective. So that's why just very minor prerequisites, really. And always G6PD levels. And that will be determined by your clinician in relation to, because this is an oxidative therapy combined with ozone therapy. But the light itself, really no, but more of the combo of using it with the ozone therapy as well.
So what is that? They have to check with their physician or their general practitioner on what?
It's called G6PD levels. And
Is that a test or?
it is a test, and we request that all the time for our patients here. So they're definitely going to be in the clear if you're going to go through that device.
Okay, so that's something that they would have to do first is get a blood test for that specific, what you just mentioned.
Yeah, that's usually
Um,
standard, and it's part of our standard protocol with our patients.
okay, and then they can go ahead and do it. Is there situations or circumstances where maybe you'd want somebody to do a detox or some other treatment before they do this, or can they go right to it?
Yeah, so that's a good question. I usually prefer patients to go through detox just for the reason that I always tell patients that, hey, if you buy a house, you don't want to go in there with the furniture of the previous owners, right? You want it out so that you can put your new stuff in. They're all going to be looking nice. Same for the body. If you're going to put in therapies in your system, you want to get the junk out so that you can put new things in, and they will all coincide and they're all going to be working better. So that's why this is administered in a patient through a protocol. It's not just do just UVBI, and that's it. Like for straight successive times, you will get effects with that, but you're not going to maximize the effects. Maximizing the effects will be in relation to doing specific protocols or mixing it with other IV therapies as well.
Okay, that makes sense. That was a good analogy with the house.
Hmm.
You just don't want to pile the new furniture on the old furniture, and so
Right.
a lot of people would benefit from a couple treatments, maybe a couple IVs to
Hmm.
get their body in a position there where they can receive this better and get more positive benefit from it.
Right.
Okay, so now on our next couple of interviews, I'm going to have more questions, but because we're getting these questions from people in the clinics, from your clinic, and from just the people working in the clinic are feeding me these questions. So last one, and then like next time I'll ask about other types of illnesses or conditions that this can treat. But how about cancer? This seems like it would be beneficial in treating cancer because of the oxygen. Oxygen kills cancer, right? So can this be used to treat cancer?
Again, yeah. So when we use it in cancer, I always kind of use the word support. When we say treating cancer, there is really a multifactorial approach towards that. I mean, even chemotherapy. So, yeah, so going back to cancer, the one that really was part of the indication of this device would be more blood based cancers, such as lymphoma, leukemia, to support the ongoing therapies of these patients. And then again, we when we use it as support, it means that we're building that immune system, especially in our protocol here, because we work with the cancer center here in town, and we actually do this in between their chemotherapies, may it be low dose or high dose chemotherapy. And you have to remember, UVBI is germicidal. In theory of cancer, there is some infections that can trigger cancer also, like Epstein-Barr virus, parvovirus. That can be assisted by the UV lights. And also, you have to remember the words that I mentioned a while ago, immunomodulating, meaning it stimulates the cells to fight. May it be cancer, may it be any infection, anything that is foreign that are not doing good things to our body. The UVBI will assist with that. And you're right, going back to oxygenation, increasing the oxygen. Cancer cells, they don't like oxygen at all. Once you introduce a lot of oxygen through the ozone, which device that goes along with this, that also now can be productive for the therapies. And also, this is one thing that why athletes do this, just because of the increasing the oxygenation. They like what it brings to the table for their training, for their recovery. But going back to cancer, and also the treatment also lowers down inflammation. As we all know, cancer promotes inflammation by releasing these enzymes that they create to promote more inflammation around them for them to grow. And also combined with other IV therapies, which I think I will mention in the future, or we just mentioned in the past, it also is getting more potent shaded. For example, when we do high dose vitamin C, peroxides along with it. So these can actually be synergistic and can be way more effective.
Okay, totally makes sense. How it can support. And you brought up a point. Obviously, athletes, this is huge for people who want to. I mean, more oxygen in your body, in your blood. I mean, I can't describe. I mean, anyone who understands the body, you know, the physiology and all that stuff, the chemistry of the body knows that you oxygenate your body. I mean, whatever your sport is, you're going to break records at it, for sure. I mean, it just I don't know that everyone's going to be affected the same, but I just know how the body works. It seems like that would juice you up. So
Well, that's correct because recently we just had one of the basketball players here in town. I don't want to mention what team or where they are, but they do get treatments here for that. Again, nothing that is bad about what they're doing. It's more for regeneration, healing, and also enhancement of the body's capacity to exercise and perform.
yeah, that's a whole nother topic which we'll talk about in one of our interviews to come. So that's Dr. Nario, Biointegrative Health Center. We're talking about UVBI, and it's an exciting treatment that they do at Biointegrative Health Center. Thanks for being with us, Doctor.
Steve, thank you again. Always a pleasure. And as we all know, knowledge is power. And thank you for letting me provide you with the edge in longevity and health maintenance, which I call the biological edge or the bio edge.